Hi, I'm Dr. Preston Parry, and a common question is why is infertility considered genetic? And frankly, it often isn't. Doesn't matter what the genes are so much for pelvic inflammatory disease. If you had an STD that obliterated your tubes or ruptured appendicitis, that is less of a genetic component. If you are a heavy smoker and start losing the eggs, that is less of a genetic component. If you are in a same-sex relationship, though some people talk about that as having a genetic component, if your partner doesn't have any sperm, that is not necessarily a genetic thing. There are things that do matter that are genetic. For example, if you look at egg quantity, women whose mothers went through menopause early actually may be more likely to go through menopause early themselves. So if they're running out of eggs and they're poor quality, that can be genetic. PCOS, or polycystic ovarian syndrome, that can run in families. And as a result, if you end up gaining weight because of this genetic predisposition to gain weight and have extra male hormone, that can lead to irregular cycles. And if you aren't releasing eggs, it's harder to get pregnant. That absolutely has a genetic component. If you happen to be in a family where you are forming fibroids, and fibroids are passed down. They were the first contraceptive, effectively, that was reliable, where people would form fibroids in their 20s and then not be able to conceive, but because you had a 1 in 10 chance of dying from pregnancy 10,000 years ago, you would be around to raise your existing children from your teens. But that is absolutely genetic, and so people who form a lot of fibroids are less likely to be fertile. However, there are also a lot of components that are not genetic. It matters less whether or not your parents had a history of subfertility, and it matters more where you personally are. And we see this all the time. People coming in say, my brothers and sisters all have a ton of kids, we don't. Why? There is a very large non-genetic component. What is more important than the family history, though that matters, is saying where are you now and having a systematic approach to evaluating the sperm, eggs, tubes, and uterus to understand those core building blocks for fertility. So see a clinician, get evaluated, and get understanding and control over your body. Thank you for listening. Share with others to broaden knowledge of fertility, and please ask us any questions we should answer. Thank you.